This video and its description is for doctors only. We all know that the coronavirus has disrupted all activities all over the world. The worst affected are the persons involved in healthcare. Many doctors, nurses, and paramedical workers have died. Due to fear, many doctors have closed their clinics. Care of the non-COVID patients has been affected severely as they could not move for consultation and for closure of the clinics and hospitals. In this video, I shall describe certain guidelines for doctors which they can adopt to run the clinic safely without much of fear. These guidelines are: 1. If you have got two adjacent rooms connected by a door, cover the door with a transparent plastic sheet. You sit in one room and the patient will sit in the other room. Pull your chair and table near the door and put the chair of the patient on the other side. So, between the doctor and the patient, the plastic sheet will work like a shield. If you do not have two rooms, you can partition one room into two parts by hanging plastic sheets. You sit in one part and the patient will sit in the other part. The height of the partition should be more than 6.5 feet so that even if a tall patient coughs or sneezes, he will not spread the virus to the other side. Do not allow anybody to come to your side. The medical representatives can meet you only from the other side. In the plastic sheet, make a U-shaped cut, and this will create a flap. Through the flap, you can transfer things like prescription or investigation reports with the patient or others on the other side. Even you can examine the patient through this flap. If your room is provided with AC, arrange your table in such a way that air from AC will flow from your side to the other side, not in the reverse direction. If you do not have AC, arrange a wall fan behind you or put a pedestal fan behind you so that air will blow away from you, not towards you. Fourth point, do not run the ceiling fan. It will disperse the virus's particle to all parts of the room. Fifth, do not dry sweep the room, both the rooms. As you know, these viral particles are very heavy and they quickly settle to a surface and particularly to the ground. Dry sweeping will send the viral particles to the air from the ground. Now, instead of dry sweeping, try to mop the floor with hypochlorite solution. Sixth point, do not keep many things on your tabletop. It will be difficult to sanitize all of them daily. Before you begin your clinic, this is the seventh point, before you begin your clinic, wipe the tabletop with sanitizer. Eighth point, wear good quality mask and other personal protective devices. A full PPE kit is not required. Time to time sanitize your hand with sanitizer, particularly after handling outside things. See that only the patient himself comes for consultation. If very much required, allow one more person. See that both of them wear mask covering nose and mouth. Before entry, this is 9th point, before entry they should sanitize their hands and if possible sanitize their documents in a UV sanitizer, ultraviolet sanitizer. Do not allow the patient to carry unnecessary things with him. 10th point, patients having fever for less than 10 days should be asked to attend the fever clinic run by the government or ensure COVID test before proceeding further in his treatment. At no time you should open your mask. So stop taking any food or drink in the clinic. Do not allow many people come for consultation on any day. They will make a crowd which is against the government guidelines. Now if all of us follow these guidelines, we can run the clinic safely and the non-COVID patients will definitely get genuine medical care.